Come in.
Okay. Hi, my name is Megan. I'm going to be your nurse today.
Hi, Megan.
Can you tell me your name and date of birth?
Kathy O'Neill, March 6, 1947.
Okay, Kathy, we're going to start by doing a head-to-toe assessment. First, I'm going to go ahead and wash my hands, and then we'll begin.
Okay.
Do you have any questions?
No.
All right. Okay, Kathy, we're going to discuss your health history first.
All right.
Can you tell me if you have any allergies to medications, supplements, or food?
Codeine.
Codeine. What
Okay.
happens when you take codeine?
I just get severe headache, so I don't know that I'm really allergic or just oversensitive to it.
Okay. Anything else?
No.
All
Not
right.
that I can think of.
And as far as your health history goes, I have you've had an appendectomy in the past.
Yes.
You've had 2 pregnancies.
Yes.
Both children are living.
Yes.
You have COPD,
Mm-hmm.
hyperlipidemia, or high cholesterol.
Yes.
Okay. Atrial fibrillation,
Yes.
hyperthyroidism,
Yes.
osteoporosis,
Yes.
general anxiety disorder,
Yes.
squamous cell carcinoma,
Yes.
and some seasonal allergies.
Yes.
And I also have down that you're a current smoker.
Occasionally.
Okay. And what is occasionally? How many cigarettes a day?
Maybe 3 or 4.
Okay. And as far as your medications go, I have that you're taking flecainide, 50 milligrams twice a day.
Yes.
Okay. You're also taking metoprolol, 12.5 milligrams twice a day.
Yes.
I also have temazepam, 15 milligrams at night before bed. All right. I have methimazole, 5 milligrams every day.
Yes.
Okay. I also have you have a Symbicort inhaler that you're taking 2 puffs twice a day.
Correct.
Okay. You're also taking Eliquis, 5 milligrams once a day.
Yes.
I have a torvastatin, 10 milligrams once a day.
Yes.
And you take a calcium vitamin D supplement once a day.
Yes, that's correct.
And a B12 supplement once a day.
Yes.
Okay. Sounds good. Do you have, so you also went through menopause at 50?
Yes.
Okay. And as far as your family history goes, I have down that your father had coronary artery disease.
That's correct.
Your mother has a history of alcoholism and depression.
Yes.
And your brother had several strokes with no long-term deficits.
Yes, that's correct.
Okay. And I'm going to go ahead and get started by taking your vital signs, if that's okay.
Okay.
You can either place both of your feet on the floor, or if you want both of your legs in bed, that is fine too. All right. I'm going to take your blood pressure, and then I'm going to listen for your heart. Feel for your pulse. Okay, if you would just rest your arms like that for me. And while that is taking, I'm going to feel your pulse. I'm going to have your pulse at 77, and I don't have a blood pressure cuff for it, so we're going to try again.
Okay.
Maybe we'll just lift up your sleeve.
All right.
Thank you.
Did seem to be taking a long time.
I thought I heard it detach. Alright, so just keep it nice and loose.
So pulse is 77, isn't that good?
Mm-hmm. So normal pulse is between 60 and 100.
Oh, all right.
And your pulse seems regular when I feel it at the radial site where I was just touching. And that was a good sign, especially since you have AFib. And AFib can make it a regular heart rhythm, and your rhythm feels regular.
Good.
It's almost finished. Are you having any pain?
Nope.
No? Are you suffering from seasonal allergies right now with the pollen?
Yes.
What happens when you suffer from seasonal allergies with the pollen?
My nose drips a lot. I have congestion and cough.
128/72. It's a great blood pressure. Okay, and your respiratory rate was 14, so that's a good respiratory rate. Very calm. Okay. I'm going to start with your head, and we're going to work all the way to your toes.
Okay.
All right. Do you have any bumps, bruises, cuts on your head that I should know about?
Just a bump on my forehead, which now is turning yellow.
Okay, so I see that
That's
you
from
have
last week.
some yellow midline here up by the hairline. Is that painful at all when I touch it?
When you touch it, it's a little painful.
A little painful. Does it feel tender or sore?
Yeah, it just kind of hurt, like right about here.
Okay, right in the middle.
It's getting better.
It's getting better. Okay, I'm just going to feel your head to see if there's any bumps or anything that I need to be aware of. Have you had any major hair loss?
Not major. My hair is definitely thinning in the front.
Okay. And then I see that you have a scar over your right eyebrow.
Yes, that was one of the surgeries for the squamous cell.
Okay. And they were able to remove all of it from the side of your face.
Yes.
All right, I'm going to take a look at your ears. Do you have both of your ears pierced?
Yes, I do.
Okay. Everything looks clear. There's no hair in your ears, so that's nice. And this ear is also pierced. You have a little dry skin on the outside of this ear.
I've been having that a lot.
Okay. Can use a simple moisturizer for that. All right. I'm just going to look up your nose real quick. Your nose is clear. If you could open your mouth for me so I can look inside your mouth. All right. There is no lesions in your mouth. Can you stick out your tongue and say ah?
Ah.
Do it one more time.
Ah.
Okay, great. All right. Do you have any dentures or partials?
No.
All your teeth are intact?
Yes.
And you've had just cavities filled?
Yes.
Okay. All right. I am going to have you close your eyes and I'm going to touch your face. And I need you to tell me if you cannot feel me touching either side of your face and tell me which side I am touching.
Okay.
Okay?
Left side. Right side. Right side. Left. Right.
Okay. And now I need you to tell me whether or not what you're feeling is sharp or soft. Okay? If you could close your eyes for me.
Soft. Sharp. Sharp. Soft. Soft. Sharp.
Okay, great. You can open your eyes back up. All right, I'm going to have you take a look at the safe in there.
Okay.
Okay, don't look away. And then I'm going to shine a bright light in your eyes, okay? Good. All right, both pupils constrict, and they are about a 4. All right, they're both round. And now I see you have glasses. What do you use your glasses for?
Both far and near.
Okay, so are they bifocals?
They're progressive bifocals.
Okay, and do you have an astigmatism as well?
Apparently slightly.
Okay,
Yeah.
all right. So we're going to keep your glasses on since you see with them. I'm going to have you cover your right eye, and I'm going to check your peripheral vision.
Okay.
And I'm going to see if you can see how many numbers I'm holding there, okay? So keep your eyes on my nose and don't look away. How many fingers?
2.
Okay.
1.
Okay.
3.
Okay.
2.
All right. Now switch hands. Keep looking at my nose, okay? How many fingers?
1. 1. 3. 2.
Okay, great. Now, I want you to follow my pen. Don't move your head. Just follow my pen with your eyes, okay? Okay. You can follow very good. There's no nystagmus or shaking of your eyes, so that's good. Your peripheral vision was also intact. I'm going to test your hearing, okay? So I'm going to whisper a word. I'm going to get behind you, and I want to see if you can hear what I'm saying.
Okay.
Okay?
This should be good.
Ready?
Yeah. Kitty cat.
Okay.
Shall we?
Okay, great. So that's good. You don't have any hearing loss. Do you turn up the TV very loud at night?
I have a tendency to do that. Yes.
Okay, all right. So it's good that you can still hear whispers, but you might be having some mild hearing loss if you find yourself turning on the TV a little bit higher than normal.
Okay.
Okay? I'm going to put my hands on your shoulders, and I want you to shrug them. Shrug your shoulders. Go like this. Shrug your shoulders. Good, good. I'm going to put my hand below your jaw, and I want you to open your mouth. Good, okay. Can you puff out your cheeks like a fish? All right, give me a big old smile. Let me see your teeth. Good. Now raise your eyebrows really high. Okay, awesome. Now frown. Okay, good. Everything's symmetrical on your face, so which is good. When we see differences, it's a sign of a stroke, but you don't have any symmetrical changes. Okay?
Good to know.
It is very good to know. All right, I'm also going to feel for your muscles here. Can you clench your jaw down? Good, I can feel that. And go ahead and clench one more time. Good. Now and release. Now can you open and close your mouth? Good. All right. I don't hear or feel any popping. And I'm just going to feel for your temporal arteries. I'm going to just remove your glasses for a minute. All right, they're about a +1, your temporal arteries. So that's good. Next, I'm going to move down. Okay, I'm going to move to your neck and take a look at everything. So I see some sun damage on your neck.
Yes.
All right, so has that gone away? Has that gotten any better?
No, some of it is literally just there all the time.
Okay.
Some of it is little scratches from, I have this little granddaughter that likes to grab at me.
Okay.
So could be some of that.
Could be some of that. All right. I'm just going to check your trachea and make sure that it is in the middle. All right. And can you swallow for me? Good. That's good. I'm going to check your carotid arteries. Good. Both are nice and a +2. I'm going to take a listen to them real quick. Make sure we don't hear anything swishing around in your arteries. No. That carotid has no bruising. No bruit in that artery either. Very good. Okay.
What's bruit?
A bruit is a swishing sound that we hear within the artery that may indicate that there's turbulent blood flow or plaque buildup.
Oh, okay.
Puts you at risk for having a stroke. So that's a good thing. They are
Very
clear. Good. All right. So next I'm going to move on to your chest. I'm going to listen to your lung sounds. I'm also going to listen to your heart sounds. Okay. Lung sounds take a little time, so we're going to start with that one first. Okay? So I'm going to start up here. I'm going to take a look and make sure I don't have any lesions. Nope. And your last mammogram, when was it?
Actually, I have a diagnostic mammogram coming up this Tuesday.
Okay. And have you had any abnormal mammograms?
Many years ago.
Okay.
But I had a biopsy and everything was fine. It was just a cyst.
Great. Yeah. Okay. I'm just going to have you breathe normally for me. Just so I can take a look. All right. AP diameter is 1 to 2, which is good. That means you don't have any barrel chest. Those with COPD tend to have a 1-to-1 ratio, so that their width and how they're wide and depth is all around the same. That's what we call a barrel chest. So, but you are symmetrically appropriate. All right. So I'm going to go ahead and take a little feel, make sure we don't have any crepitus, which would be little air pockets under the skin. Don't feel anything. going to take a listen. We're going to start with the front and then move to the back. And each time I place the stethoscope, I want you to take a deep breath. If you feel you're starting to get dizzy because the deep breaths are hard to take over and over again, just let me know and we can pause. All right. Exhale. Good. Exhale. Exhale. Okay. And exhale. Good. And exhale. 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 I'll go to the side here. Okay, exhale. Exhale. All right, how are you feeling?
Fine.
All right. You have a little bit of a wheeze on your left lower lobe.
Okay.
And I'm going to listen to your back. Exhale. 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 Good. Exhale. Good. Exhale. 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 Good. Exhale. Good. All right. Your lungs sound clear from the back, which is good. You feeling a little dizzy or anything?
Not really.
Okay. Next, I'm going to listen to your heart sounds so you can just breathe normally. I'm going to listen to them at different points, and then I'm going to listen to them a second time because I'm listening for any murmurs within the valves.
Okay.
Okay. Do you have any history of murmurs?
No.
Okay. All right. I'm just going to listen down here for just a minute. Okay. Now I'm going to listen to see if you have any murmurs. You okay?
Yep.
All right. I do not hear any murmurs.
Good.
Very good.
Now, how is that different from what you were listening before?
So we have a diaphragm and a bell. So a bell hears really hard to hear sounds, and sometimes the movement between the blood between the valves is a harder sound to hear, so that hear sounds that are deeper within the body.
Oh, okay.
Yeah. I'm just going to take a look at your back to see if we have anything. Your skin looks normal and it's intact. There's no differences here. I don't feel any lumps, bumps. Okay. All right, so next I'm going to have you lay down in bed because I want to take a look at your abdomen and assess that, okay?
All right.
Move your tissue here. Okay. Do you have any pain in your abdominal area?
No.
Have any issues with diarrhea, going to the bathroom?
No, occasionally, like anyone.
What's the occasional?
Maybe a couple of days ago, it's like intermittent, depending on what I'm eating, I guess.
Okay, so what's intermittent? Are we talking about bowel movement or urination?
Bowel movement.
Okay,
yeah.
And is it constipation or diarrhea that we're talking about?
Typically diarrhea.
Diarrhea? Yeah. Okay, and how often, you said like a couple days ago it happened, how many episodes during that day did you have?
A couple.
A couple?
Yeah.
Like one or two?
One or two, yeah.
Okay, alright. Alright, so loose stool can happen depending on what you're eating. Any issues with constipation?
Not usually.
Not usually?
I have in the past, but.
Okay. Do you have any hemorrhoids?
I'm not sure.
Okay.
I think a couple times when I had diarrhea, I felt like maybe I had a little bit of hemorrhoid going on. It was very itchy and burning.
Okay. Any blood after you wipe when you have normal stool?
Yeah, one time there was.
Okay.
Yeah.
All right. Any pain when you're having a bowel movement?
No.
All right. For urination, do you have any sense of urgency? Like you have to go to the bathroom right away?
Yes, sometimes, definitely.
Okay. And we can discuss that. There's some exercises you can do to help with that sense of urgency. Okay. I'm just going to listen to your bowel sounds, and then I'm going to go ahead and feel around for anything. Okay. I don't see any pulsation from your aorta. Your aorta runs down the middle of your body, and for some people we can see it pulsating, but I don't see that happening. No. Alright, your bowel sounds are active. I'm just going to feel your stomach to see if there are any spots of tenderness, to make sure it's soft everywhere. Does any of this hurt while I press down on your belly?
No.
Okay. How about down here?
No.
All feels normal?
All good.
Okay, good. And now I'm just going to tap over certain areas where your organs are to see what the sound is, okay?
Okay.
That's good. So we can hear the thud. Okay, so that's over your liver and your spleen and your stomach here. Okay. I'm just going to feel your radial pulses as we work our way down. Got +2 pulses. I see that you have some scarring on your hands.
Yeah.
Now you do take Eliquis, so you're at a higher risk for bleeding. Okay.
I bruise very easily.
Bruise very easily.
But this right here is from surgery for squamous cell carcinoma.
Okay, I see the scar there. And I also see some sun damage on your arms as well. Okay. Need to make sure that you're using an SPF of 50 when you go outside. Okay. All right. Now I want you to lift up your leg for me and hold it there for 5 seconds. 5, 4, 3, 2, 1. Okay, you can put it down, and we're going to do the same with your right leg. 5, 4, 3, 2, 1. Good. You can put your leg down. I'm going to have you try to pull me down. Pull me down with this leg. So pull your leg towards the bed. Good. Now push up. Push up. Okay. Now we're going to do the same with your right leg. Pull me down. Good. And push up. Awesome. Pull your toes. All right. Pull your toes towards your nose. Okay. Now push down on the gas. Good. Can you give me 2 thumbs up? All right. Can you give me 2 peace signs? Like we're in the 70s. There you go. All right. I want you to grab my hands. Squeeze as hard as you can. Hard, 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 hard. Good. All right. Now I want you to pull me down towards you. Okay. Now push me away. Push, push, push. Good. All right. So you got really good strength, which is good. We always worry about falls when anyone is on Eliquis because of your risk of bleeding. All right. I'm going to just check your legs out real quick. Here we go. So I see you have a little bit of hair loss on your legs.
Yes.
When did that start?
I'm going to say about, I really noticed it maybe 4 or 5 years ago.
Okay. And you also have some sunspots on your legs as well.
Yeah.
And I see...
Even though I'm never in the sun anymore, but...
But you used to be.
Right.
And I do see some varicose veins.
Yeah.
And how long have you had those?
Oh, quite a few years.
Okay. Any pain in your calves?
No, they get achy at times when I'm on my feet for a long time. But...
Okay. I didn't see any redness or swelling, so
No.
that's good. We always have a concern with deep vein thrombosis if you have periods where you're standing for a long time or sitting for a long time.
No, nothing like that.
Okay. I'm going to have you sit back up on the bed if you can. All right. And there's just a couple more things we're going to do. I'm going to test your sense of smell, your taste, and we're going to walk. And I just want to see what your gait is, okay?
Okay.
All right. So first we're going to test your sense of smell. I want you to close your eyes and tell me what this smell is. Smell it?
Mm-hmm. I'm not sure. Try it one more time.
There you go.
I want to say, I don't know, eucalyptus or kind of mint.
Okay. Let's try this one.
I smell it, I can't identify it.
Were they different?
They're different,
Okay.
definitely, but I can't tell which one. There are smells that I've smelled before, but I'm not sure.
Okay. So the first one was lavender.
Oh, okay.
And the second one was peppermint.
All right.
Okay. And now we're going to try a couple different foods, and I want you to tell me if this is salty or sweet. All right. I'm going to place this on your tongue. There you go. And you can eat it.
Oh, it's salty.
Okay, good. And I have a cup of water here for you so you can swallow it. And you can open your eyes. You can't see the other one. All right. And close your eyes again.
Definitely sweet. Chocolate.
Mm-hmm. All right, good.
I know the good stuff.
All right. Okay, so now I'm going to have you stand up.
All right.
And just stand still for a minute. All right, there's no swaying. I'm going to have you walk to the wall and walk back for me. No swaying or unsteadiness with your walking, so that's good. Okay, that's it.
That's it?
Yeah. And can you tell me what your last weight was?
138.
And your height?
5'4".
5'4". All right. That sounds good. Okay. And when I felt your pulses in your feet, the ones behind your ankles were a +1, and the ones on top of your foot, the pedal pulses were +2, so that's good.
Okay.
All right. Do you have any questions?
No.
All right, and before you leave, we're going to go over some education, so if you'd like to sit down, that would be fine. All right, so as far as everything goes, make sure you go to your eye doctor regularly once a year to make sure your vision is checked, so there's no cataracts, macular degeneration, glaucoma, and that your vision isn't changing.
Yeah.
So make sure you go to those and keep up with your dermatologist. With those presence of the squamous cell carcinoma, you want to make sure that there are not other ones popping up. You also want to make sure that you are minding your surroundings so that you're not bumping into things, or making sure that everything is clear so you don't trip over anything and fall. If you fall while you're on Eliquis and hit your head, you could end up with a brain bleed, and that's very serious. So you need to take the steps to avoid those situations.
Okay.
While you're working, a great way to help with those cramps in your legs or calves, make sure you stay hydrated, drinking water a lot, and wearing compression socks all the way up to your knees. Those help a lot.
Okay.
I know that they help a great deal.
I'll have to get some of those.
Yes, definitely. I wear them. I think they're great. Because your family has a risk of coronary artery disease and stroke, you definitely need to continue to go to your primary care once a year to have your labs drawn to make sure that nothing is abnormal. You're taking the atorvastatin for your high cholesterol, which is good. It's a good preventative measure. And then metoprolol for your rhythm regulation. That's also an important measure. So you have to take your medications too, as your doctor prescribes. If you stop them suddenly, then you could give yourself a heart attack or stroke. Okay?
Okay.
Smoking. Have you quit before?
Yes.
Okay. And what was the longest you went without smoking?
9 months.
9 months. That's a good stretch. And what helped you quit smoking then?
Just made the decision.
Okay. All right. Did you use any aids like nicotine patches or gums?
Nicotine patch.
And that helped?
Yes.
Okay. All right. So I do encourage you to look towards stop smoking, because as you are on heart medications as it is, the flecainide, the metoprolol, and the atorvastatin to help with your arteries from building up with plaque, the more that you keep smoking has an effect on your vessels and constricts them and makes them really small. So it decreases the amount of blood that gets to your heart. And if you have had any issues with your heart in the past, it's only going to increase.
Okay.
All right. Make sure that you take your vitamin D and your B12. That helps with your bones and for good digestion. Again, water, lots of water, good fiber to make sure that your bowels stay regulated, so you don't have those instances of diarrhea or having any constipation.
Would you suggest that I start taking a probiotic again? I used to.
With that, I would speak to your physician.
Okay.
If you ever take antibiotics for anything, take a probiotic with it, because antibiotics tend to strip our normal gut bacteria out of our body. So we like to replace that with probiotics.
Right.
So I would speak to your primary care about that. Also great for cardiac health. You want to exercise. So just minimally is 150 minutes a week, which sounds like a lot, but it's only 30 minutes a day. And that could be just walking around the neighborhood, which it just has to get your heart rate up and make you breathe a little bit harder, but you can still talk during those activities.
Okay.
And the more that you increase that activity, the better heart health you have. Okay?
All right.
Any questions about anything we talked about today?
I don't think so.
All right. Well,
this has truly been the most comprehensive and longest assessment I've ever had.
Well, I hope I've answered any questions you had. And, you can always reach out if you have any further questions or need anything.
Okay.
All right.
Thank you.